So, naturopathic medicine, right, is preventive medicine that uses a wide variety of natural therapies to keep your mind, body healthy and strong. So, we are going to be talking about autoimmune disease today with a naturopathic doctor who's joining me live from Canada. Dr. Moulton is a naturopathic doctor. She focuses on autoimmune disease. Welcome, Dr. Moulton.
Hi, thank you for having me here. I'm very excited to be here today. So, like Amita said, I am a naturopathic doctor who has focused on autoimmune disease. And so today I wanted to talk about autoimmune disease in a whole through a naturopathic lens, because I think that all of us know more of the conventional side of things, and I just want to open it up to what it's actually a lot more of than just the basics. So, autoimmune disease is really a chronic inflammatory disease. It can affect your whole body. It depends on where your body's targeting its autoantibodies. And so I like to break it down in pieces to make it easier to digest. And so I like to use Pac-Man and a chessboard to explain your immune system. So your immune system consists of two parts. It's your innate immune system and your adaptive immune system. And so in autoimmunity, our adaptive immune system is out of whack. It's overreactive to some part of your body. And so it's important that you're still nurturing that immune system and not depleting it. Because unfortunately, most of our conventional treatments is suppressing our immune system totally so that we can get the autoimmune condition under control. But the innate immune system, which is our Pac-Man, so they go around our body all the time and they're cleaning it up. So they take care of environmental parasites, toxins, bacteria. They're always in the body, they're always working, and they're making sure that your blood cells have the nourishment they need. So they'll actually go into each blood cell and make sure there's nothing in there that's eating your B12 or anything like that. And so I feel like a lot of times we forget that autoimmune disease isn't just suppressing the whole immune system. It's about addressing the underlying reason or the root cause of that autoimmune flare-up. And so the adaptive immune response is where we get the flare-up. It consists of two pieces, your T cells and your B cells. And so we'll just ignore the T cells for today. It's the B cells we're worried about, because the B cells create antibodies. Now, in a healthy immune system, we create antibodies whenever we come in contact with something so that we can fight it better. So, and this is how vaccines work. Yes, I'm a naturopathic doctor and I'm going to talk about vaccines very quickly. When you have a vaccine, you're exposed to something, just like if you're exposed to something for the first time. And so your body creates in its warehouse these pieces to attack that foreign invader, right? It's something foreign to you. It shouldn't be in there. It could be harmful. And so the first time you're exposed to it, it takes time to build that, right? And so you're sick for longer. Now, the second time you get introduced to that same foreign invader from your environment, now you have those building blocks already, and they're unique, and they attack a certain way. And so that's where I like to talk about the chessboard, because it's more of like, instead of a pawns, it's like the queen or the knight or something like that, because they're unique to that specific attack that they're going to do. The problem arises is when our body creates those attacks, so whether it's a knight or a bishop or wherever, to our own healthy tissue. So let's talk about thyroid, for example. The thyroid gland sits right here, and it can be, it's actually two potential autoimmune triggers for this one, because you have Graves' disease and you have Hashimoto's. And both of them are autoimmune triggers that tend to happen postpartum. So they are triggered by having children and stress and not having sleep and there's a whole bunch of different environmental factors that play in. But what they do is once it's triggered, what do? They attack the thyroid gland. They attack it in different ways. So one, you develop hyperthyroidism where it's becoming more active. And the other one, it attacks it where it damages the cell to the point where you become hypo because your thyroid is just no longer able to function. So there are two different ways that they attack. And so they attack differently based on what condition you have. So I'm not saying that every autoimmune disease is the same. It's not. But the underlying root cause, the immune system being overactive, the potential environmental triggers that are bringing it on or bringing on flare-ups, as well as the overall inflammation that the body gets built up from the immune system is all the same. Whether you have MS, Sjogren's, scleroderma, rheumatoid arthritis, ankylosing spondylitis, like the list goes on and on and on. Something as simple as psoriasis or eczema, right? All of these autoimmune diseases stem from the exact same process. And so when it comes to treating autoimmune disease, it's very, very simplified. If you think about it, you're treating the root cause. It's the same all around. And so I did notice your website, you had something about hydration on there.
Yeah, we're trying to educate people how, to drink more water. Simple things like that, right?
Very simple. And what I tell every single patient is, how do you put out a fire? Right? If inflammation is fire in the body, how do you put it out? You put it out with water. And so just starting with the very basic, making sure that you can get that water in to bring down the inflammation overall is the first starting point, right? Mm-hmm. Now, there are other things involved. For example, I like to use a lot of live blood analysis. Have you ever heard of live blood?
No.
Yeah, so I work out of a clinic here in Oakville they have live blood technicians. And what they do is they take a finger prick of your blood and they show it on the computer screen under a microscope. And what's really neat is they can see how your immune system's functioning, what kind of environmental toxins you have, if you have extra sludge, if you're not digesting your fats and food properly. And it can see the environmental parasites, worms, bacteria, fungal, all of these things. And what I like to use that for is it's giving us information as to why your immune system might be overactive, right? If you have a lot of bugs in your system, your body is constantly trying to clean up. It's constantly trying to work, and it's overworked, overstretched. And so, of course, it's going to make mistakes, right? So that's one thing that I've always started to add into every autoimmune patient protocol, because I've seen such a significant benefit by unburdening the body, right? Getting rid of all this overload to give that body some rest, because it needs it, right? Another thing that I do at my Burlington clinic is I do IV therapy. So intravenous nutrients specifically. And so a lot of my Crohn's patients, ulcerative colitis, celiac, all of the GI health issues tend to come to there for IV therapy, because we can get the nutrients right into the system while we're trying to heal the gut. And so you don't have to have Crohn's or ulcerative colitis or anything like that to benefit from IV therapy and to benefit from gut health, because honestly, the gut is your foundation. If your gut is inflamed, if it's leaky, if the microbiota is out or off, then you're going to have issues, whether it's autoimmune or not. It all stems from the gut. And there's actually been shown specific bacteria that trigger autoimmune disease that can be in your gut. So before you even get a diagnosis of MS or something like that, just knowing what's in your gut now addressing it and getting rid of it and cleansing yourself to have better bacteria is so beneficial going forward for overall longevity and health. One of my favorite tests for that actually shows the autoimmune triggers is called GI map. Now, I know that that's available in Canada and the States. I don't know about anywhere else, but that is a test that would be of interest if you're looking at the gut health, the microbiota, the function, as well as the potential for autoimmune triggers. So what I've kind of thrown out microbiota quite a bit, and I'm not sure if everybody knows what that is. Do you know what that is?
I'm not a scientist. I'm just trying to advocate natural medicine here, but I think a little science 101 would be useful from you.
Yeah. So I tend to kind of go off the handle and start talking about things and not realize where my level's at, but that's okay. The microbiota, I like to explain it as a garden. So your garden that you have typically, you want to have beautiful flowers, right? You want to have them arranged in a specific order. You want lots of color, right? That's a good, healthy microbiota, which is your gut flora. We all have bugs in our system. There's ones that are beneficial to us that work with us, and there are some that are bad for us. They can cause inflammation, bloating, gas, pain, etc. We don't want them. Now, those bad guys would be like the weeds coming in. So if you're not plucking or pruning or removing the weeds, they can take over, right?
Yeah.
They tend to flourish in a very sad diet. So the standard American diet, where it's very acidic, they love, 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 love sugar. So sugar is pretty much in everything, right? Yeah. And so whenever we can alkalize the diet, get more fiber in there, we're already forcing those weeds to be uprooted because they don't like those conditions. And so whatever we can do to get rid of those weeds is absolutely important to continue to have that flourishing, beautiful garden. That's going to benefit you.
I love the way you're explaining it. It's very simple. People we can understand, make our garden look beautiful inside. It's as simple as that.
It's as simple as that. And so realistically, if you can get your gut health in order, your garden in check, you can get your immune system unburdened so that it's only reacting to the things it needs to. And you have extra water to help hyperhydrate your body, put out all those fires. Those are really the three major things to reducing or reversing autoimmune flares. So I'm actually going to say as strong as the word reversing, because you can't cure autoimmune. Once it's triggered, you have it. But there's a difference between being sick with autoimmune and thriving with autoimmune. And so what I teach people is that you don't have to be controlled by your label, by your autoimmune disease. You can still achieve optimal health and wellness and enjoy life. And I call it health freedom.
I think that's very powerful what you said. I just have one question now. The things that you said make sense, taking care of your gut health, but, and you talked about some of the other IV, therapies that you do, but do you also use like herbs as well, like naturopathic herbs to help with the autoimmune diseases? Are there any
yeah. Oh, yes.
Okay. That was a question.
For sure. I use nutrition. I use herbs. I love herbs. But I'm targeting it specifically where they're at. So am I addressing a leaky gut? Well, then I'm going to give specific things to patch up the drywall, right? We want to make sure all the holes are patched up so that we're not having the environment so exposed to our blood. If it's the liver, if the liver's bunged up, it's not able to get rid of all the toxins, we're going to give herbs to boost it, to support it. Or kidneys, we're not clearing things out properly, supporting the kidneys, whatever we can do to allow the body to address the problem itself. Okay. So I do like to encourage the own machinery to do its job, but at the same time, sometimes your body needs a little extra, right? So if you have a bit extra parasites or bacteria in your system, your immune system's already overworked. Well, let's get rid of it with some oil of oregano or garlic, or like there's so many thyme.
Yes.
There's so many herbs out there that are excellent at targeting specific microbes. So, for example, a fungal infection, I would be going towards the antifungal herbs
Yeah.
versus a bacterial infection. I know certain bacteria respond differently based on whatever herbs are available. And so, and where they're located also is a huge thing too. So if it's in the blood, with the live blood, helping move lymphatics, helping with circulation, using alternative herbs that clean the blood is super important, with just cleaning and filtering your blood out. So one thing I also I say often to patients is I explain the liver like a sponge. So if your liver's a sponge and you're using it on the counter, if it's bunged up and has a bunch of stuff in it, is it going to clean the counter? No. You're just going to be washing your counter with grossness, right?
Yeah.
And so it's important that that liver is really rinsed out. I would say 3 to 4 months every year, just to get it to where it needs to be again, right? Because I mean, especially in North America, we have on the rise fatty liver disease. And that is a great example of that sponge being full of food, being full of stuff that you don't want, and it's just not functioning the way you need it.
It makes sense. It makes sense what you're saying, and cleansing yourself 3 to 4 times in a year, like what you, to your point, especially we're exposed to all kind of toxins, right? Whether it's an environment or cleaning or what have you. How would you like to summarize with for people who have autoimmune disease? Where should they start? What do they do?
Well, I would say find a practitioner that does focus on it. So I know with naturopathic medicine, I have to be careful. We're not allowed to use the word specialist or expert. In Ontario, that's our rules. We're not allowed to say that. But find somebody who's interested in it, because I do have colleagues who just, they wouldn't want to touch it. Or if they do, they're just going to give you the very, very basic recommendations, like the water and the gut health, and stop there. So find somebody who is talking about it, who's in your area, who's interested in your autoimmune condition. And then from here, to start today, obviously increase your water. People keep on telling you, increase your water, increase your water. It's important. You need water to function. It does everything in the body. So start there. If you're having gut issues, definitely something to look into is some sort of detox cleanse, just to help clean anything in there that's not supposed to be in there, and hypernourish to get everything that you need back in.
Okay, well, thank you so much, Dr. I think this is amazing. This is a really simple information that you are propagating, that we can all at least take care of ourselves with simple hydration to begin with. And if the symptoms persist, then we seek out, a medical, a practitioner, natural medicine practitioner, I'm going to call, not an expert, who can help you with autoimmune disease. And understand, all autoimmune disease have the same root cause. That's what Dr. Moulton just said, right? It's the same. It doesn't matter whether it's eczema, cirrhosis, multiple sclerosis, or anything else that you talked about.
Yeah, they all stem from the same thing. They're all chronic inflammatory diseases that are related to the immune system being hyperactive. And so if you understand that root cause, it's very simple to treat. It's just something that starting out is simple, and then you have to get into like the more detailed, in-depth treatments as you go further.
All right, well, with that, we'd like to wrap up this session. Take care of your immune system. You don't want these autoimmune diseases to start attacking your cells in your body, right? That's really what we are saying. And if these things persist, seek out a practitioner. So take care of yourself. Self-care is very important. And start with hydration. That's what I want to leave it at. With that, thank you so much, Dr. Moulton, for being with us. Appreciate that.
Thank you for having me.
Absolutely. Thank you. Bye-bye.